Very good morning, all. Today, I will speak about the functional constipation. If we see our routine OPD, more than one third cases are the constipation cases. So, when we call functional constipation, child has a constipation without any organic pathology, then we call the functional constipation. So, before labeling as a functional constipation, child should have the following symptoms. One is passing less than 2 episodes of stools in a week, had a difficulty in passing the stool, and sometimes there is the staining of the stool matter under the undergarments. And most important thing is the position of the child while passing the stool. He will stand up position with the crossed leg. Actually, child will be in that position to stop the passing the stools rather than the passing the stool. And we have to rule out some conditions before labeling as a functional constipation. In that, most important history. Child should pass meconium within 24 hours. There should not be any abdominal distension. There should not be any neurological markers over the spine like tuft of hair, all these things. These things should be ruled out. At the same time, child should not have any failure to thrive. So, developmentally normal child without failure to thrive have issues of constipation. We can consider of the functional constipation. So, how will you manage the child with functional constipation? Before going that, we have to know the pathophysiology of functional constipation. Whenever child wants to pass the hard stool, it gives like so much pain to him, and he will postpone the passing the stools. Whenever he postpone the passing the stools, the water will be absorbed from the stool. Again, it become more harder. Again, more harder, more painful. This is all like a cycle. So the main strategy of the treatment in functional constipation is the to break the this cycle. So how will you break the this cycle? So for that we have to do first important thing like a disinfection of the stool followed by maintenance of the stool. The first for disinfection we have to use the routine like a polyethylene glycol. There is n number of companies. Some will come powder, some will come liquid, some will come in bottle, some will come in the packet. Whatever it may be, the disinfection dose will be 1.5 to 2 grams per kg per day for 3 to 7 days. Once child passed stools with this disinfection dose, then we have to change into the maintenance dose. The maintenance dose will be like a zero point 0.5 to 1 gram per kg per day. Again, I'm telling loading dose will be 1.5 to 2 grams per kg per day, followed by maintenance dose is 0.5 to 1 gram per kg per day. Once child started an disinfection for 3 to 7 days, followed by maintenance should be there by 3 months, followed by slowly tapering next 3 months. Along with this pharmacological therapy, we have to tell them to few non-pharmacological management to treat the constipation. One thing, child has to the pass motion immediately around within 30 minutes after the taking the feed. So to utilize the gastrocolic reflex to pass the stool. Second one, has to use the Indian toilet. If he no Indian toilets available in their house, they has to like a keep the stools like that. The final result should be there should be flexion at the hip and the knee, and daily he has to spend around 15 to 20 minutes in the toilet whether he pass the stool or not. Most important thing like a diet. Diet should be contain fiber diet. Majority of things this functional constipation will see in the around 6 months to 2 years child. One of the most common is the predominantly milk diet. Milk is notorious to cause constipation. Should avoid milk beyond 400 ml and should avoid maida and bakery products. And always encourage fruits and vegetables for their routine food. So this is the management of the functional constipation. It will prevent the UTI, and child appetite also will improve after managing properly in the constipation. How important it is a constipation? Recent UTI guidelines are telling that child should be on uroprophylaxis unless this bladder bowel movement has to be cleared, because there is a chance of getting a UTI with this functional constipation. Thank you.